Hello and welcome to Nurse's Handbook. Today we will be practicing some image-based questions. Question number 1. Identify the equipment. A. Simple oxygen line. B. Nasal cannula. C. Venturi mask. And D. None of the above. And the correct answer is B. Nasal cannula, which is also known as nasal prongs. It is a lightweight tube which on one end splits into two prongs that is placed in the nostrils to deliver oxygen, and nasal cannulas are used when we have to administer oxygen less than 5 liters. Question number 2. In which procedure is this position given? A. Paracentesis. B. Lumbar puncture. C. Thoracentesis. And D. Both B and C. And the correct answer is C. Thoracentesis. Thoracentesis is also known as pleural tap. In this, a needle is inserted into the pleural space to remove the excessively accumulated fluid, blood and air. Question number 3. Identify the tube. A. Suction tube. B. Cuffed ET tube. C. Oropharyngeal tube. And D. Uncuffed ET tube. And the correct answer is B. Cuffed ET tube. The cuff provides seal within the airway when ET tube is placed in the trachea. Question number 4. Identify the mask. A. Nebulization mask. B. Venturi mask. C. Face tent. And D. Simple oxygen mask. And the correct answer is D. Simple oxygen mask. Simple oxygen mask is a type of low flow mask which draws oxygen from the atmosphere, and it delivers a variable oxygen percentage of 21 to 60%. Question number 5. Identify the equipment. A. Inhaler. B. Incentive spirometer. C. Portable nebulizers. And D. None of the above. And the correct answer is B. Incentive spirometer. It is a medical device which helps patients improve their lung functioning by doing deep breathing exercises. Incentive spirometer is also known as deep breathing lung exerciser. Question number 6. Identify the tube. A. Uncuffed ET tube. B. Nasogastric tube. C. Cuffed ET tube. And D. Oropharyngeal tube. And the correct answer is A. Uncuffed ET tube. It is specially used in children aged 1 to 8 years during the intubation. Question number 7. Identify the equipment. A. Non-rebreather mask. B. Ambu bag. C. Self-inflating bag. And D. Both B and C. And the correct answer is D. Both B and C. Ambu bag means artificial manual breathing unit, which is also known as a self-inflating bag, and it is used to provide positive pressure ventilation to the non-breathing patients. Question number 8. Identify the machine. A. BiPAP machine. B. Nebulizer machine. C. DVT pump machine. And D. Ventilator. And the correct answer is D. Ventilator. It is an automatic machine which delivers breaths to the patient who is physically unable to breathe. Question number 9. Identify the medical equipment. A. Fingertip pulse oximeter. B. Saturation sensor. C. Portable pulse oximeter. And D. Both A and C. And the correct answer is A. Fingertip pulse oximeter. It is a non-invasive tool used to measure the amount of oxygen carried in the body. Question number 10. Identify the equipment. A. Pulse oximeter. B. SpO2 sensory probes. C. defib cables. And D. None of the above. And the correct answer is B. SpO2 sensory probe. This device emits light, and the amount of light absorbed by the blood indicates the oxygen saturation. Question number 11. Identify the equipment. A. Oropharyngeal airway. B. Nasopharyngeal airway. C. Orogastric tube. And D. NG tube. And the correct answer is A. Oropharyngeal airway. Oropharyngeal airway is also known as the Guidal pattern airway. It is used to maintain patent airway, and it also prevents tongue fall. Question number 12. Identify the tube. A. Oropharyngeal airway. B. Nasopharyngeal airway. C. Uncuffed ET tube, and D. None of the above. And the correct answer is B. Nasopharyngeal airway. It is also known as nasal trumpet or nose hose, and it is inserted into the nasal passageway to open the airway. Question number 13. Identify the equipment. A. Tracheostomy tube, B. T-piece, C. Transtracheal catheter, and D. Nasal cannula. And the correct answer is C. Transtracheal catheter. It is surgically placed in neck, which rests in the trachea, and it is used to provide direct oxygen to the lungs. Question number 14. Identify the mask. A. Nebulization mask, B. Oxygen mask, C. Phase tent mask, and D. Venturi valve mask. And the correct answer is D. Venturi valve mask. It is also known as air entertainment mask. It provides defined oxygen concentration to the patients who are on controlled oxygen therapy. Question number 15. Identify the article. A. L-piece connector, B. T-piece connector, C. Y connector, and D. None of the above. And the correct answer is B. T-piece connector. It is a pipe connector which is used to deliver humidified oxygen to a trachea or ET tube. Question number 16. Identify the mask. A. Oxygen hood, B. Aerosol mask, C. Venturi mask, and D. Phase tent mask. And the correct answer is D. Phase tent mask. It provides controlled oxygen concentration and increased moisture. For example, it is used in cases of facial burn, nasal bone fracture, and claustrophobic patients. Question number 17. Identify the article. A. Phase tent mask, B. Tracheal mask, C. Venturi mask, and D. Non-breather mask. And the correct answer is B. Tracheal mask. Tracheal mask is placed over the tracheostoma and secured around the neck. Question number 18. Identify the device. A. Cuffed tracheostomy tube, B. Cuffed ET tube, C. Cuffless tracheostomy tube, and D. Uncuffed ET tube. And the correct answer is A. Cuffed tracheostomy tube. It is placed in trachea and it allows positive pressure ventilation and prevents aspiration in the patients. Question number 19. Identify the mask. A. Nebulizer mask, B. Non-rebreather mask, C. Anesthesia mask, and D. None of the above. And the correct answer is B. Non-rebreathers mask. It delivers high level concentration oxygen, that is generally when we have to give above 5 liters. Question number 20. Identify the device. A. Tube thoracostomy, B. Chest drainage catheter, C. Thoracic catheter, and D. All of the above. And the correct answer is D. All of the above. Chest drainage catheter, it is a plastic flexible tube and it is inserted into the pleural space to remove fluid, air or pus. Question number 21. Identify the mask. A. Simple oxygen mask, B. Nebulization mask, C. Partial breather mask, and D. Venturi mask. And the correct answer is B. Nebulization mask. It is used to provide liquid medicine in form of fumes to breathe in. Question number 22. Identify the equipment. A. Phase tent, B. Oxygen hood, C. Oxy head cover, and D. None of the above. And the correct answer is B. Oxygen hood. This is a plastic dome or box with warmed and humidified oxygen is provided through it. Question number 23. Identify the device. A. Puff inhaler, B. Rota inhalers, C. Portable nebulizers, and D. None of the above. And the correct answer is A. Puff inhalers. When inhaler is used, a measured puff of medicine is released through it. Question number 24. Identify the device. A. Underwater seal drainage system, B. Chest drainage system, C. Drainage bag, and D. Both A and B. And the correct answer is D. Both A and B. It is inserted into the pleural space to drain out air, blood and fluid for expansion of lungs and restoration of negative pressure in the thoracic cavity. Question number 25. Identify the device: A. Portable ventilator, B. BiPAP machine, C. HFNO machine, and D. None of the above. And the correct answer is C. HFNO machine. HFNO means high flow nasal oxygen machine, and it is a technique through which we can deliver heated and humidified oxygen with a controlled fraction of inspired oxygen at a maximum flow rate of 60 liters per minute via a nasal cannula. Thank you for watching. For more updates like this, do like, share and subscribe to our channel Nurses Handbook.